An adult normally has 32 permanent teeth. Gauge is the inside diameter of a needle. The smaller the gauge, the larger the diameter. Laws regarding patient self-determination vary from state to state. Therefore, the nurse must be familiar with the laws of the state in which she works. After bladder irrigation, the nurse should document the amount, color, and clarity of the urine and the presence of clots or sediment. After bladder irrigation, the nurse should document the amount, color, and clarity of the urine and the presence of clots or sediment. On a drug prescription, the abbreviation P, circa, means that the drug should be administered after meals. After suctioning a tracheostomy tube, the nurse must document the color, amount, consistency, and odor of secretions. Axillary temperature is usually 1 degree Fahrenheit lower than oral temperature. A thready pulse is very fine and scarcely perceptible. The nurse should use a warm saline solution to clean an artificial eye. To remove a patient's artificial eye, the nurse depresses the lower lid. OU means each eye. OD is the right eye, and OS is the left eye. Brutes commonly indicate life or limb-threatening vascular disease. During the evaluation step of the nursing process, the nurse assesses the patient's response to therapy. Gastric lavage is flushing of the stomach and removal of ingested substances through a nasogastric tube. It's used to treat poisoning or drug overdose. A foot cradle keeps bed linen off the patient's feet to prevent skin irritation and breakdown, especially in a patient who has peripheral vascular disease or neuropathy. Ballottement is a form of light palpation involving gentle, repetitive bouncing of tissues against the hand and feeling their rebound. During percussion, the nurse uses quick, sharp tapping of the fingers or hands against body surfaces to produce sounds. This procedure is done to determine the size, shape, position, and density of underlying organs and tissues, elicit tenderness, or assess reflexes. A patient must sign a separate informed consent form for each procedure. Before signing an informed consent form, the patient should know whether other treatment options are available and should understand what will occur during the preoperative, intraoperative, and postoperative phases, the risks involved, and the possible complications. The patient should also have a general idea of the time required from surgery to recovery. In addition, he should have an opportunity to ask questions.